time to talk to members of the medical community. Today, it's one that kind of gets me where I live. We have Dr. Lydia Wright, who is a maternal fetal medicine specialist here in Wilmington. Good morning.
Good morning.
We've been chatting offhand. Dr. Wright kind of helped us in a big way with our own children. We won't go into that, otherwise I will start to ball the entire process. When we talk about your specialty, right away it's high-risk pregnancies.
Yes.
So right off the bat, what do you consider high-risk pregnancies, and how early in pregnancy do you know that it is going to be a high-risk affair?
Well, there's all sorts of conditions that moms can have that can lead them to a high-risk status. The most common thing that we see people early for is if they're carrying multiples, which you're familiar with. Also, if a mom has a high-risk condition like hypertension or diabetes or lupus or some other kind of serious medical condition. Some people have lost pregnancies early in the past, and so they know that they're at a higher risk to have a preterm birth again.
I know when we came to see you, our visits to a doctor were much more frequent. Talk about the testing that you're able to do and kind of get people in line knowing where they need to go.
For prematurity?
Yeah.
Yes. Well, it's, first of all, most people can go through a whole pregnancy and do everything right, and they don't know that they're at risk for preterm birth. But if they've had a prior preterm birth, there are several things that we can do, and it takes an evaluation and consideration of different kinds of medications that we can use now to prevent a preterm birth. Used to be, we didn't have anything to prevent preterm birth, and now we have a couple of agents that we can use prior to embarking on the second trimester, where we can help people to prevent that preterm birth, and that's what it's all about, is prevention.
And I know it's not something that's specific to, you know, family history. Anyone can have a high-risk pregnancy.
Yes, anyone can, and there are many folks who don't have any medical conditions, don't have any family conditions, but they just end up having a high-risk pregnancy. There's some who do have those risk factors beforehand, and it's good to get early medical care so that we can do the best to have the best outcome. So
if you know you're having, if you're already know you're going to have a high-risk pregnancy, what are some of the issues that you see right now? And I don't want to say treatments, but how likely is it that women will be fine? It seems that because we can detect things so earlier, and with the advances of medicine, that the risks are not as great as they once were.
Oh, very much so. You've got it right. If we know that somebody has a high-risk condition, a medical condition, then we can anticipate any problems, and with meticulous medical care for like control of diabetes or control of hypertension, then they have the best outcome possible. Now, most times it is a good outcome. Certainly, as you know, because of what I do with high-risk patients, that sometimes that doesn't happen, but most times we're able to treat patients. And now with this new therapy to treat preterm labor, we actually, for people who are at risk for preterm labor, we actually have good treatments to try to prevent those preterm births. And we can prevent preterm births in about a third to a half of patients.
That's
a big deal.
Yeah, I could go on and talk to you all day. You know that. She's an angel.
Oh, you're so sweet. You're so sweet.
I'm not going to do it. I'm not going to do it. If you need any more information, don't talk to me because I'll start crying about it. Always contact your medical professional. Dr. Lydia Wright is one of those.
Thank you.
Thank you, Lydia.
Thank you.